We have to get him inside now.
What's happening to him?
Just hurry through these doors.
Got it, I'm opening it.
It's his heart. We need to get to the ICU now.
Go, save my son!
He's in VTAC, starting CPR.
Vital stabilizing. He's breathing. Thank you, doctor.
Respect is expensive when you learn it too late from the woman you thought was beneath you. Tae Young learned that lesson in the pediatric intensive care unit of Mercy Medical Center in Dallas when he watched his 7-year-old son Min-jun slipping toward death in a hospital bed, surrounded by cardiologists and pulmonologists who had all given up until Dr. Amara Williams, the young black physician everyone at the hospital had mocked and dismissed as unqualified, walked in and recognized what no one else had seen, and with nothing but her expertise and her refusal to accept the diagnosis everyone else had accepted, saved a life that the most celebrated doctors in Texas said was already lost. The story started 6 months earlier, when Tae Young's empire was at its strongest. He was 47, had built himself from street enforcer to undisputed leader of the largest organized crime syndicate in Texas. He controlled gambling operations, protection rackets, money laundering through legitimate businesses. He had politicians in his pocket, police commanders who looked the other way, rivals who were too terrified to challenge him. He was the kind of man who made other powerful men nervous. He was also the kind of man who believed that money solved everything, that wealth and power could be substituted for actual knowledge, that if you paid enough, you could buy your way out of any problem. His son Min-jun had been born with a heart defect. Nothing life-threatening immediately. The pediatric cardiologist had explained it during the pregnancy scan, had said with proper monitoring and eventual surgery, the boy would likely live a normal life. Tae had not wanted to hear about likely. He had wanted guarantees. He had paid for the best cardiologists in the world to be on standby when Min-jun was born. He had arranged for specialists to be available 24/7. He had spent hundreds of thousands of dollars to ensure that his son would receive the absolute best medical care available. What he had not done was actually listen to what the doctors told him. What he had not done was accept that his money, while useful, could not actually change the fact that his son had a serious medical condition that required careful management and genuine expertise. When Min-jun was 6 months old, Tae had decided the boy was fixed. The cardiologist had said the defect was manageable, which in Tae's mind meant managed. He had dismissed the recommendation for ongoing monitoring. He had told the specialists they were no longer needed. He had instructed his wife, Young-suk, to stop mentioning the heart condition as if acknowledging it would somehow make it worse. Min-jun was going to be fine because Tae Young did not accept anything less than fine in his life. Weakness was not permitted. Vulnerability was not tolerated. And certainly, the possibility that his son might have a chronic condition requiring lifelong management was not something Tae was willing to contemplate. When Min-jun turned 5, the mandatory school physical had revealed that his condition had worsened. The heart defect that had been stable at birth was now causing concerning changes. His heart was working harder than it should have to. His oxygen levels were lower than normal for a child his age. There were early signs of pulmonary complications. The school's physician had recommended immediate cardiology evaluation and specialist care. Tae had paid the school physician to sign off on a clean bill of health instead. He had told Young-suk the boy was fine, had instructed her to tell Min-jun he was strong and healthy, had essentially decided that if he refused to acknowledge the problem would cease to exist. It did not work that way. When Min-jun turned 7, he could no longer keep up with other children at school. He became tired easily, got winded walking upstairs, complained of chest pain that he was too frightened to mention to his father, because his father had made clear that such complaints were signs of weakness. He had started getting recurrent respiratory infections. Nothing serious initially, just normal childhood colds that somehow lasted longer than they should have, that seemed to hit him harder than they hit other kids, that left him coughing for weeks after other children had recovered. Young-suk had taken him to doctors despite Tae's prohibition. She had gotten a referral to Mercy Medical Center, had found Dr. Amara Williams, a pediatric cardiologist who had a reputation for being thorough and unconventional in her approach to complex cases. Dr. Williams was 34, had trained at some of the best medical schools in the country, had published research on pediatric cardiac complications, had built a reputation as a brilliant physician who did not accept conventional wisdom if the evidence suggested a different answer. She was also Black, which was apparently relevant to approximately half the families who came to Mercy Medical Center and immediately requested a different doctor. At the first appointment, Young Suk had brought Minjun alone. Teo had refused to attend, had made clear that he considered the visit unnecessary and wasteful. Dr. Williams had conducted a comprehensive evaluation. She had taken a detailed history, including the school physical findings and the recurrent infections. She had done a physical examination that was thorough enough to catch details the school physician had missed. She had ordered imaging studies that showed the extent to which Minjun's heart defect had progressed. And she had been direct with Young Suk about what she was seeing. Your son's cardiac condition has deteriorated significantly since birth. The defect that was stable in infancy is now causing complications. His heart is enlarged, his output is compromised, he's developing pulmonary edema, which is why he's getting these infections that won't go away. Without intervention, this will continue to worsen. We need to start him on medications immediately and discuss surgical repair within the next few months. My husband thinks he's fine. My husband says the doctor said it was manageable. Manageable does not mean he can be ignored. Manageable means with proper medical care, he can have a normal life. Without that care, his condition will deteriorate and eventually become life-threatening. You need to convince your husband to allow appropriate medical management. Young Suk had tried. Teo had refused to listen. He had forbidden Minjun from taking the medications Dr. Williams had prescribed. He had refused the surgical consultation. He had essentially decided that the problem could be managed through denial. For another 6 months, Minjun had lived without the medical care he needed. And then one morning in early October, he had collapsed at school. Not just tired or winded, collapsed. Unconscious, rushed to the emergency department, admitted to intensive care with a diagnosis of acute heart failure and pneumonia, the culmination of months of a deteriorating cardiac condition combined with recurrent respiratory infections that were attacking a heart that was already struggling. That was when Teo's denial had finally shattered. He had rushed to the hospital, had immediately tried to use his resources and his connections to fix what had become unfixable through neglect. He had demanded the best cardiologists. He had demanded the most experienced physicians. He had demanded outcomes that expertise alone could not guarantee. And instead of Dr. Amara Williams, he had gotten Dr. Marcus Chen, the hospital's chief of cardiology, white, male, celebrated surgeon with international reputation. Teo had been satisfied. This was the kind of doctor he understood, prestigious, accomplished, someone whose expertise he could pay for. Dr. Chen had looked at Minjun's condition and had delivered devastating assessment. The heart defect has progressed too far. The complications have compounded. We can try surgery, but his heart is too weak for the operation. And without the operation, his heart will continue to deteriorate. I'm being honest with you, your son is in critical condition. Even with aggressive intervention, the prognosis is poor. What does that mean? What percentage survival rate? I mean that realistically, with the current level of deterioration, we're looking at maybe 30% chance he survives the next week, and if he does survive, we're talking about a life of severe limitation, likely requiring transplant at some point, which he may not be a candidate for given his current status. I'm sorry, but this is where we are. Teo had demanded a second opinion, and a third, and a fourth. Every cardiologist he consulted said essentially the same thing. The boy's condition was critical, the damage was extensive, intervention was unlikely to help at this point. It was during one of these consultations that Dr. Amara Williams had encountered Teo in the hallway outside Minjun's room. She had been reviewing Minjun's chart, had noticed that despite her previous recommendations, the medications she had prescribed had never been started, that the surgical consultation had never occurred, that the boy's condition had been left untreated for months while he deteriorated. She had looked at Teo directly, with no deference, no sense of intimidation by his obvious power and his obvious fury. You ignored my recommendations. You told your wife to stop bringing him for care. You denied him the medications that would have prevented this acute crisis. Your neglect caused this. And now you're demanding miracles from physicians when the real damage was done through your refusal to accept that your son needed medical care. Teo had stared at her, shocked that anyone would speak to him this way. Who are you? I'm the doctor who evaluated your son 6 months ago. The doctor you apparently did not think was good enough for him, because I'm not the chief of cardiology. I'm not internationally famous. I don't have credentials you can throw money at to feel impressive. I'm the doctor who is actually right about what your son needed, but you were too arrogant to listen. I don't need your blame. I need solutions. You need to accept that your son is in critical condition because of decisions you made. And then you need to get out of the way and let doctors who actually understand what he needs try to help him, because right now you're more interested in your own ego than in his survival. She had walked away, leaving Teo furious, humiliated, and terrified. That night, Minjun's condition had deteriorated further. His oxygen levels had dropped. His heart rate had become irregular. The machines monitoring him had alarmed constantly. The attending physicians had convened to discuss whether continued aggressive intervention was appropriate or whether it was time to transition to comfort care. In other words, they had begun preparing for his death. Teo had sat beside his son's bed, looking at the small boy whose condition he had ignored, whose needs he had dismissed, whose suffering he had contributed to through his refusal to accept reality. And for the first time in his life, he had been completely powerless. Money could not fix this. Violence could not fix this. Connections and fear and intimidation could not fix this. His son was dying, and there was nothing he could do except sit there and watch it happen. That was when Dr. Amara Williams had entered the room. Not as an attending, not as the lead physician, but as someone who had been monitoring Minjun's case, who had been reviewing his labs and imaging despite not being officially assigned to his care, who had noticed something that everyone else had missed. I need to do another ultrasound. The current cardiologists are correct that his cardiac function is severely compromised. But I think the acute deterioration is not just from the cardiac defect. I think there's something else happening, likely a pericardial effusion that's developed acutely, which is compressing his heart and making everything worse. If that's what's happening, we can drain it. It won't fix the underlying cardiac defect, but it will improve his immediate status enough to potentially make him a surgical candidate. The other doctor said. The other doctors are looking at his baseline cardiac disease and concluding that everything is hopeless. But medicine is not always about the obvious diagnosis. Sometimes the acute crisis is caused by something treatable, something we can actually intervene on. I think that's what we're dealing with here. And if you're wrong, then we're in exactly the same position we're already in. But if I'm right, we buy him time and improve his chances. And I have enough confidence in my assessment to stake my reputation on it. Teo had stared at her. This black woman he had dismissed as beneath his concern, whose recommendations he had ignored, who was now offering the only hope anyone had offered. Do it. The ultrasound had confirmed her assessment. There was indeed a pericardial effusion, fluid accumulating around Minjun's heart, compressing it, making it impossible for it to pump effectively. It was treatable. It required a procedure called pericardiocentesis, insertion of a needle into the space around the heart to drain the fluid. It was also dangerous, particularly in a child with severely compromised cardiac function. One wrong move, one complication, and Minjun could die. Dr. Williams had explained this clearly. I can do this procedure. I've done it dozens of times. But I won't hide from you that there's risk. Given his baseline condition, any complication could be catastrophic. But I'm confident I can do this safely, and I'm convinced it's what he needs. Teo had authorized the procedure without hesitation. He had watched from the observation room as Dr. Williams, with controlled precision and absolute focus, had guided the needle into the space around his son's heart. He had watched as the fluid had drained, dark yellow, thick, exactly as she had predicted. He had watched as, with each milliliter of fluid removed, the monitors had shown Minjun's cardiac function improving. Within minutes, Minjun's oxygen levels had risen. His heart rate had stabilized. The irregular rhythm had returned to normal. The child who had been dying was suddenly breathing better, his color improving, his body beginning to respond to the fact that his heart could finally pump blood effectively again. Dr. Williams had completed the procedure, had spoken to the nurses about monitoring the drainage, had then approached Teo in the observation room. He's stable now. Not out of danger, his underlying cardiac defect still needs to be addressed. But the acute crisis is resolved, and we can now proceed with the surgical repair we discussed 6 months ago. He's going to need that surgery within the next few weeks, but he's now healthy enough to survive it. Thank you.
I.
Teo had struggled for words. You were right. About all of it. I should have listened. Yes, you should have. But now you're listening, and that's what matters. Your son is going to need ongoing cardiology care for the rest of his life. He's going to need to take medications. He's going to need monitoring. He's going to need a physician who he trusts and who will tell him the truth about his condition. I'm willing to be that physician if you'll let me.
Yes.
I'm asking you to be his cardiologist. Whatever you need. I don't need anything from you except your commitment to actually follow the medical recommendations instead of substituting denial for medical management.
Can you do that?
I can. Over the following weeks, Minjun underwent the cardiac surgery that Dr. Williams had recommended 6 months earlier. The surgery was successful. The defect was repaired. His cardiac function improved dramatically. The recovery was difficult, but ultimately triumphant. And throughout that recovery, Dr. Amara Williams was present, monitoring his progress, adjusting his medications, providing the medical expertise that Teo realized he had been trying to buy his way out of needing. During one follow-up appointment, when Minjun was healthy enough to be discharged and moved to outpatient care, Teo had asked Dr. Williams directly about her decision to push her way into his son's case despite not being officially assigned. Why did you do that? Why did you care enough to get involved when the chief of cardiology had already determined it was hopeless? Because I knew I was right. The imaging I had seen 6 months ago, combined with the deterioration pattern and the recurrent infections, told me exactly what was likely to happen. When it did happen the way I predicted, I knew my assessment of how to help was also likely to be correct. And because your son's life was worth fighting for, even if fighting meant challenging the consensus of more senior physicians. Everyone mocks you here. The staff calls you the overeager young doctor. They say you're too ambitious, too aggressive, too convinced you're right about everything. I am right about everything I'm confident about. That's not arrogance. That's accurate self-assessment. And yes, people mock me. Partly because I'm black in a field where leadership is white. Partly because I'm a woman in a field where power is male. And partly because I'm willing to question decisions that more senior physicians make, which threatens people who are invested in hierarchies based on seniority rather than on actual competence. I disrespected you. I dismissed you. You did. And you nearly killed your son because of it.
But you've changed.
You're listening now. And your son is going to have a normal life because you finally respected expertise over ego. Over the following years, Minjun thrived. He took his medications as prescribed. He attended regular cardiology appointments with Dr. Williams. He lived a life that was relatively normal for a child with a history of serious cardiac disease. And Teo, watching his son's recovery, had gradually come to understand the magnitude of what Dr. Amara Williams had done. She had not just saved his life. She had saved the life of his son. She had demonstrated expertise that no amount of money could have purchased from someone less skilled. And she had refused to be intimidated by his power, had instead challenged him directly about the damage his arrogance had caused. That was a kind of power that Teo, who had built his entire life on the ability to intimidate and control others, had never actually encountered. And he respected it. When rumors began circulating that there was pressure from some of the more senior physicians at Mercy Medical Center to limit Dr. Williams's practice opportunities, to suggest that her aggressive approach to patient care made her a liability, Teo had intervened in ways that only someone with his resources and connections could intervene. He had made clear to hospital administration that Dr. Amara Williams was to receive full support for her career development. That any pressure on her career would result in withdrawal of his family's substantial philanthropic contributions to the hospital. That any retaliation against her would result in consequences that hospital administration would find deeply unpleasant. He had also made clear to Dr. Williams that if she ever wanted anything, if she ever faced any obstacle in her career or her life, he would move mountains to remove it. You saved my son's life. I will never forget that. And I will spend the rest of my life making sure you have the resources and the support to do for other families what you did for mine. Dr. Williams had accepted his support with the same directness she brought to everything else in her life. I appreciate that. And I will continue to be the best cardiologist I can be, for your son, and for every other patient who comes to me with a heart condition. The fact that you're willing to support me is great. But ultimately, I'm good at what I do because I've studied hard, trained extensively, and I'm willing to question conventional wisdom when the evidence suggests a different answer. That's what matters.
Yes.
But it's also true that you're good at what you do despite facing barriers that physicians without your skin color do not face. Support that levels that playing field is not charity. It's justice. 3 years after Minjun's initial crisis, Dr. Amara Williams was promoted to Chief of Pediatric Cardiology at Mercy Medical Center. The promotion had come with support from Teo's contributions and his strategic interventions, but it had ultimately been earned through her clinical expertise and her research contributions and her patient outcomes. She was the first Black woman to hold that position at the hospital. At the promotion ceremony, Teo had given a speech. 3 years ago, my son was dying because I had been too arrogant to listen to a physician I had dismissed as beneath my notice. Dr. Amara Williams saved his life through expertise and determination and a refusal to accept the consensus of more senior physicians when she believed that consensus was wrong. She demonstrated the kind of excellence and integrity that should define leadership in any field. And I had the profound privilege of recognizing her value only after she had forced me to confront my own arrogance. He had paused, looking directly at Dr. Williams. I am not a man who respects many people. My world is built on people fearing me rather than respecting me. But I respect Dr. Williams completely. And I will spend whatever resources and power I have to ensure that she receives every opportunity to continue doing the extraordinary work she does. Because excellence like hers is rare, and wasting it through bias or discrimination would be a tragedy far greater than the medical crisis we overcame together. Minjun, now 10 years old, healthy and thriving, had been in the audience with his mother. After the ceremony, he had hugged Dr. Williams. "Thank you for fixing my heart. Thank you for not listening to Dad when he was being stupid." Dr. Williams had laughed. The kind of genuine laughter that comes from understanding that a child has named a truth too many adults avoid. Your father wasn't stupid. He was just wrong. There's a difference. And he fixed it. That's what matters. That night, Teo had reflected on the trajectory of his life. He had built an empire through fear and intimidation and the exercise of power over people weaker than himself. He had believed that money could substitute for everything. For knowledge, for respect, for genuine connection. He had been wrong. Real power, he had learned, was not the ability to make people afraid of you. Real power was earned through demonstrated excellence, through integrity, through a refusal to compromise on truth even when compromise would be more comfortable. Dr. Amara Williams possessed that kind of power. And Teo, who had spent his life exercising the other kind, had finally learned the difference. He had also learned that respect, once earned, ran deeper than fear. The man who had tried to buy his way out of needing medical expertise had finally understood that some things could not be purchased. They could only be earned. And the respect he had developed for Dr. Amara Williams was something he would carry with him for the rest of his life.